Consider this. In the 90s, most of what happened in terms of investments in information technology essentially led to webification of our current brick and mortar institutions. So what you ended up having was massive investment, but still you had a website that was dedicated to one agency or one bureau or one department. That's how you end up with over 24,000 websites in the federal government. But what compounds this is that the architecture and the design and the underlying platform is engineered not for the convenience of the American people, but it's engineered for the convenience of the individual agencies and the departments. And we need to shift, and we need to start using NIEM as a model to think about how do we make sure whether the services at DHS, and a perfect example there is something we just recently launched with USCIS, which was an immigration application. What used to happen is if you're an applicant at USCIS, you would actually have to either hire an attorney to figure out where you are in the whole process, where your application stood, whether it was for a green card or citizenship application, or reach out to your congressman or senator to get a status update. But what happened is the president charged DHS and USCIS more specifically within 90 days with coming up with a solution that would essentially allow anybody to go online and get access to where they were in terms of data in the application process. Were they in the fingerprinting process? Were they waiting for an interview? Where did they stand in this process? And more importantly, also creating a national dashboard that would show you average processing times at each of the field offices, whether you're in New York City or in Houston. And that wouldn't have been possible if the underlying architecture wasn't well thought through, if the underlying architecture wasn't built on NIEM. And as we think about all the other service delivery models, one of the keys has to be, as we think about agility, is how do we ensure that we're architecting platforms? How do we make sure that we're making these investments in ways that will allow us to rapidly slice, dice, and evolve our solutions to the demands that are being placed and should be placed by the American people? Moving forward, some of the big challenges that I see, and I would love to hear how this community can help, is our strategy around cloud computing. One of the things we looked at is the massive investments we're making just in infrastructure. We spend over $20 billion annually on infrastructure. And part of the reason we've done that is we've thought too much in terms of silos. We were having a conversation earlier this week with Richard from DHS, and one of the things Richard is focused on is thinking through, well, how does DHS evolve, and how do we move away from the 23-plus data centers and rationalize those investments? But at the same time, how do you move up the value chain? And part of what we're trying to do with our cloud computing strategy, and we've laid out a marker that this is not going to happen overnight, that this may take up to 10-plus years as we think about these investments. But part of what we want to do is we want to abstract the underlying complexities so we don't have to go out there and build 23 different data centers. That's what you're seeing in the physical world. In the logical world, that translates into standards too. Because on those 23 different data centers, you've probably got hundreds and hundreds of various applications that are built on hundreds of different standards across the board. So what we need to figure out, and where we really need help, is as we move into this new world where we're much more focused on service, and we start thinking about service buses, and we start thinking about the underlying architecture there, how do we in this new world think about data portability, moving from one cloud provider to the next cloud provider? What are the standards? How do we engineer it? What is the architecture? Those are still open questions, and those are some of the questions that must be answered in order for the federal government to successfully move in the cloud computing direction. Another area, of course, is security, and we've got a number of people looking at those issues. We've got a task force, as a matter of fact, that's working on security in cloud computing. But as we think about some of the challenges that we face in terms of providing services to the American people so they don't have to go out there and go on 24,000 different websites to get service from their government, we also have to think about the investments we're making, whether they're in healthcare at a national level or in education, beyond just thinking about the successes we've had in public safety. The challenge for this community is going to be thinking about how do we scale in other areas, how do we simplify so that we could attract other communities, and the fact that this is a grassroots effort is huge. I don't think I need to talk about the value of what NIEM has been able to do at the federal, state, and local level. I think you've had a number of sessions that have discussed that. But what I want to do is figure out what can we do here. I'd love to hear from you in terms of advancing this agenda, in terms of making sure that federal IT investments, as we think about the 2011 budget, 2012 budget, and onwards, that we're making the appropriate investments so that the NIEM platform, as we think about this, is baked into the architecture, so we're not having a discussion about necessarily the value of NIEM, but the discussion is more about how do we execute against the NIEM standards. So with that, I want to thank you very much for having me, and I look forward to working with all of you, and we'll be happy to take any questions you may have.
I'm Will from California Department of Social Services, and I think the two biggest major obstacles we have is not the technology, but it's the actual policy. We have siloed funding streams, especially in the health and human services world, that have been archaic. We have confusion on confidentiality and data sharing laws. So my question to you is those two areas is your power of your office going to help to try to make those changes?
So part of is this on? So that's one of the areas that we're looking at. So what's happened is, if you think about NIEM and the standards themselves, relatively speaking, it's fairly young. My understanding is that it wasn't until 2002 that we began this journey. And I think now what you're seeing is specific examples where you've had value, and that's exactly what I'm referring to as we think about 2010, 2011, the budgeting cycle. And from a policy perspective, absolutely, as we think about grant-making processes, that we're able to bake that into the requirement. But more importantly, I think where we also need help is at the state and local level, making sure that, if you look at some of the leadership that came out of various entities, whether it was New York City and in the healthcare domain, having used that standard, it wasn't federal policy that drove that. It was an organic movement within the city itself that led to that success. So the answer is yes, we're looking at the policy side of this to figure out what's the most rational way to make sure that we address those issues.
I'm Ivan Handler from the state of Illinois, the Chief Information Officer for basically our Medicaid agency. And I think one of the things that NIEM is really good for, and would be very helpful if the feds would step up into this, is to help us with the interoperability for HIE and health information in general. The problems with the standardization of health information, I'm sure you're aware of, is that we've never achieved the kind of standardization we need, and I think we're in a certain amount of danger the way things are going, that states will adopt standards or will not adopt strict enough standards so that the HIE, the National Health Information Network, may not be as interoperable as we really want it to be. And it's a little late to start, I understand, and we have to kind of figure this out. But I think if the federal government would say that we see, the NIEM standard as a target and that we're going to help everyone define it, I know a lot of states that would jump on this. We're waiting for this kind of leadership. And it's not that we don't want to take local initiative, but in something like this, if every state takes initiative, we're in danger of ending up in a much worse situation than we need to be. And I think this is an area that you and other people on the feds could really help us with a lot.
So on that specific issue, Dr. Blumenthal, who heads up the Office of the National Coordinator within Health and Human Services, is working very, very closely with us in terms of looking at health and human services, not just within the federal government, but also thinking about health IT and the $19 billion from the Recovery Act that's going to be spent on health IT adoption. And you're absolutely right. And part of this journey is also looking at where you had various bodies setting standards. You have the Federal Health Architecture Organization, and we're in the process right now of thinking through and making sure, as we look at the investments that are about to be made, that the standards coming out of ONC and NIEM, where's the intersection? Where does it make the most sense? So that we don't end up, as I said, with the investments that are being made that don't interoperate, and that we end up spending more money trying to integrate the healthcare investments with other investments that we're making.
My name is Bob Greaves. I work with the Justice Department. And I want to comment on the fact that it's only been through the good graces of what Van Hitch and his counterparts at Homeland Security have done that have enabled us to cobble together the funding necessarily to make NIEM the success that it is today. I would ask that you give some serious consideration to helping us get a line item established in the budget that would be supportive of NIEM in the future.
So I think actually one of the successes is the fact that this did occur organically. And I would argue, as we think about this, when we were talking about healthcare, for example, when we're talking about other bodies, my view is we're investing in a standard setting. What we need to do is a better job of rationalizing those investments across the federal government, number one. And number two, as these investments are being made, you look at some of these IT projects, there's no reason why architecture isn't front and center of those investments. So you're looking at some of these IT projects that are $1 billion+ and architecture becomes an afterthought. And what we're trying to do is front load a lot of the planning, the thinking, the architecture itself. And also, from an investment perspective, looking at some of the allocations that have already been made around architectural activities. And I don't know if you want to add to that.
I think it's been a strength of the NIEM program over its evolution that we've been resource-starved in terms of direct resources. The resources had to come in directly, and it's come from demonstrating value. It's been a wonderful discipline. I think back to my days when I was more directly involved with NIEM. The need to go and demonstrate value every day made us better as a community. And now I think that we're as the program evolves, there's maybe more opportunities to do more. But again, being community-based is the key. And I think that it's also really important too, as Vivek is saying, that we don't forget the discipline of planning within large programs. I think that's a big part of the success that DHS, for example, has been seeing as they reach critical mass with adoption of NIEM.